Welcome to the AUA News Inside Tract podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Hello, everyone. My name is Nana Frimpong. I'm a fourth-year medical student at Tract University College of Medicine. I'm also one of the members of the AUA Medical Student Work Group, and I'm really excited to be joined today by Dr. Jessica Mandeville. She's an assistant professor of urology at Tufts School of Medicine, and also the director of Endourology at Leahy Hospital Medical Center. Dr. Mandeville, thank you for joining. Anything else you want to add to your introduction here?
No, thank you. Thank you for having me.
Yeah, so I'm really excited to jump into endourology as part of this series about the subspecialties for medical students. I think for many medical students, endourology is kind of their introduction into urology. So I just wanted to start by just quickly defining what endourology is for those listening.
Sure. So endourology is a subspecialty within urology where we use minimally invasive techniques, usually through a natural orifice like the urethra or the ureter, to treat a variety of different urologic problems. So the most common ones you probably think about are kidney stones and ureteral stones that we can do with ureteroscopy or percutaneous nephrolithotripsy, where we go right through a tiny hole in the back. We also do a lot of endoscopic treatment of prostates for enlarged prostates. So things like transurethral resections of the prostate, holmium laser enucleation of the prostate. We also do some work in cancer fields like bladder cancer resections and upper tract urothelial cancer resections and ablations. So do quite a bit of different things in the urology realm, but all minimally invasive and easier for patients to tolerate.
Thanks for that introduction into endourology. It's a really vast field, which makes it really exciting. Can you talk a little bit about your own interest in endourology and how you came to be an endourologist?
Yeah, so when I was a resident, it really struck me as a field that was very quickly advancing. Just from the time I started residency to the time I finished residency, we had new lasers coming through, higher powered lasers coming through, and I really liked how much quality of life work we did. So, you treat a stone and someone goes from having terrible pain to being cured from that by the time you're done with their surgery. Same is true for prostate surgeries. For people who have been with catheters for months upon months, you treat their obstruction from the prostate. They go home without a catheter with a much better quality of life than they came in with. So that really struck me, and I really liked the technology.
And correct me if I'm wrong, but a lot of endourology can also be handled by generally trained urologists. Can you talk about this decision specifically to get a fellowship in endourology?
I mean, I specifically did a fellowship because I wanted to do advanced kidney stone work and some metabolic kidney stone work and more advanced BPH surgeries. But nowadays, there's so many fellowship trained endourologists scattered throughout all the residency programs in the country that residents are getting very high-end endourology training now.
Mhm.
So much more advanced training than we got, say, even when I was a resident. I didn't graduate all that long ago, 2010. But I think the advanced training that residents are getting now is substantial. I think if you want to be highly academic, I think if you want to do very advanced complex stone disease, then maybe a fellowship is warranted. But I do think that there's a lot of very good training and that many procedures can be performed by a well-trained general urologist.
And I know you kind of already touched on it. But you talk about some of the pros and cons for getting a fellowship in endourology? Obviously, when it comes to more advanced stone disease, probably an endourologist be handling that. But are there any other things to consider for our students?
Yes, I think, I think it depends on the degree of training you get at your own personal program. I think for people who are interested in pursuing an academic career, then a fellowship's the way to go to get publications and do, different types of research. I think, I used to say that if you wanted to do laser enucleations of the prostate, that you probably have to do a fellowship, but now we have so many people training residents in that across the country that may not necessarily be the case. Some people choose to do an endourology fellowship that's combined with laparoscopy and robotics. and they want to be like a lap endo person, so that they can treat more cancers, and also do some endourology stone work. So that may be a reason to do a fellowship as well. Although the training in robotics and laparoscopy now is also, very much taught and alive and well just in residency.
That's good. It sounds like that most people who go into urology residency will probably have a pretty robust experience with endourology, and that should help them in the decision making to go for a fellowship. Would you agree with that?
Absolutely. Absolutely.
Talking a little bit more about your day to day, could you give some of the pros and cons in terms of quality of life for an endourologist?
Yeah, so I think the quality of life as an endourologist is excellent. A lot of our surgeries are day surgeries. So we come in, we see the patient, we do their surgery, they're able to walk out the door a couple of hours later. Um, they're very minimally invasive. So patients tend to do well, not have a lot of patients that we have to worry about being in the hospital that are sick. And, it's a nice variety, which I like. I like to come in and do some stone cases, do a BPH case, maybe do an upper tract tumor, something like that. So you can really vary your day up. And we do take care of some very sick patients as endourologists. Some of the complex stone patients with terrible infections, they can be very challenging and difficult to take care of.
Mhm.
But I do think the lifestyle is pretty good. Most of the patients are going to do very well. Most of the patients are going to be able to go home, which means you don't have a huge service to round on in the hospital every day. It also means that you're not worrying up all night about these big, huge surgeries that you've done for maybe
Mhm.
a bad cancer. Although I do have stayed up worrying about some very sick stone patients, but I do think it's a nice lifestyle, and you also get to do a nice variety of cases, so you don't get bored.
Absolutely. And endourologists are always busy. Whether that's a pro or a con, I'll kind of leave it up to the listener, but
Yeah.
definitely a lot to do in endourology.
Yes, you will never be short of work as an endourologist. That's for sure.
Now, going more towards the student side of things, I'm a medical student who's rotating on urology, and I'm with you either in clinic or in the OR. What are some things that you expect your medical students to know about endourology coming in?
Yeah. So I think, as a medical student, there's not a ton of exposure to urology early on. So in your first few years, so I never expect medical students to come into my OR and know a ton about urology, because why would they? They're not getting
Hmm.
that much exposure. I expect or and hope that they'll know the general basics of, what the urethral anatomy is, what the bladder anatomy is, and the ureter and kidney anatomy. I don't expect you to know all the details of every last blood supply, but just, UPJ, UVJ, ureter crossing the iliacs, the points where stones can get stuck,
Hmm.
the general basics of stones. What kind of stones? Are there any diseases that may make patients more prone to stones? And indications for why we may want to treat a stone. And even that may not, some medical students may not know that because they've had so little exposure to urology. A little bit of the basics of, the very basics of anatomy, the very basics of stone disease, and maybe the basics of BPH and why it causes problems. And then the rest is up for me to teach you and get you to know a little bit more about it.
I think it's a very fair ask of our students. And, you did mention the rest is kind of up for you to teach, but, at the end of the day, when someone goes through a rotation, has pretty good experience with endourology, what are your goals for them to learn in the rotation?
My goals is for them to understand the pathophysiology of stones, why people form stones, why we choose different procedures. So why do we choose a shockwave versus a ureteroscopy versus a PCNL? What types of things can we do to help people prevent stones? What are we looking for specific diseases like hyperparathyroidism or something that can cause a patient to have stones? And then the basics of BPH, what type of symptoms can BPH cause? What are the different options available to manage BPH, whether it's office-based procedures, operative procedures, things like that. And just to get a good sense of really what's out there for us in the world to do with endourology.
Yeah. And what's out there is really always changing in the field of
Yes.
urology, but especially in endourology, which is another reason that I really enjoy the field so much. But are there anything kind of new or on the horizon in terms of developments in endourology we should look out for as students?
Yeah, so there's always something new, especially in the BPH space. There's always something new. There always have some new device coming out. I think what I've seen as I've gone through endourology is we started off when I was a resident with these low power lasers that took forever to treat even small stones. And now we have these ultra high powered lasers that can break stones down into sand and dust in minutes. We now have steerable and suction access sheets where, the number of percutaneous procedures that we need to do have dramatically decreased because we can now do these bigger stones with these high powered lasers in our suction access sheets. We now have office-based procedures to manage, the appropriate prostate for BPH. So for patients who are trying to preserve sexual function or decrease the risks of leakage, things like that. If they're an appropriate candidate, we have some office-based procedures we can do. We even have some interventional radiology procedures we can offer for patients who are too sick for surgery. The technology for BPH, when I was a resident, we basically had two options, a TURP staged or an open simple prostatectomy. We haven't done an open simple prostatectomy at Leahy in 13 years. Almost everyone with a big prostate gets done with the laser enucleation. They go home that day or the next day and do really well. So I think there's just going to be more advances in laser technology, more advances in sheets and suction access. And then the BPH space is the Wild West. There's something new to look at pretty much every week. So, and some of those things will be good and some of those things will not be good, but it'll be interesting to see how they all play out.
Yeah, I really do believe that endourology kind of leads the way in terms of innovation when it comes to urology. And I know you being, very high volume in New England area, kind of see it all. So it's really great to get your perspectives. As we wrap up here, just talking to medical students in general about urology, endourology, any last words for our students?
I would just say anyone who has any doubts about urology, you should check it out. Urology is, I knew nothing about it when I went into medical school and I just kind of landed on a urology service during general surgery. Never would have thought about it in my life and I loved it. There's so many things to do in urology. If you like big open surgeries, you can be a big cancer oncologist. If you like endoscopic surgery, you can be an endourologist like me. You can be a general urologist and do a whole variety of everything from prosthetics to stones to bladder cancers, anything. So really give urology a look and really take it, think about it seriously because it's a great field. There's also a lot of medicine in urology. So if you're someone who wants to still use your medical brain more than just your surgical brain, we do a lot of metabolic workups for kidney stones. We do a lot of medical management of different conditions. So I think it's just a great field overall. And of course, I think endourology is the best part of urology, but I liked all parts of urology. So I hope people really get an interest in the field. We have a huge need for urologists in the coming years. So we need you. And stone disease just keeps getting more and more and more. And the burden of BPH becomes more and more and more. So we need a lot of good general urologists and a lot of good endourologists.
Absolutely. I couldn't agree more. All those things are why I decided to pursue urology, and I'm excited to get started in my career. And I hope that this podcast helps other medical students pique their interest too.
Great. Thanks for having me and best of luck at Emory.
Thanks so much.
This has been an AUA News Inside Tract podcast. To hear more episodes of this podcast, visit www.auanet.org/podcast.